hope that you will continue to take care of each other like you always have, and which is what makes you a great team and great providers, great professionals. So with that, we will open the line to questions.
Thank you. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first, from City News, Jonas.
Good afternoon, Mr. Husa, Minister Friesen. First of all, thank you for doing this today on Sunday. Minister Friesen, the first question will be for you today, and I think it's one many in the community will be asking. You've announced a number of steps today, but I mean, why was not any of these taken earlier? I mean, how did it have to get to this point before this is done?
It's a fair question. Thank you for the question. Thanks for being here today. So action has been taken, and action has continued to be taken throughout this pandemic. We are not immune to COVID-19, and neither are our systems immune to the effect of COVID-19 and the effects on them. That's why we worked as hard as we did, and system leaders worked as fast as they did to prepare for COVID-19 in our care homes. The fact of the matter is this, is that when COVID-19 gets into personal care homes, it can have a devastating effect. We have 19 care homes right now that have outbreaks. There isn't a province in Canada that doesn't have an outbreak right now. It's why we took some of the measures that I referred to just previously. It's why we've worked hard to understand what's going on here. I want you to know that when we started to see what we saw in respect of Parkview Place and Maples, I actually called for regular briefings to be provided to me at my office with all of the appropriate persons and agencies at that table. And so we've had those meetings with the Deputy Minister, with the WRHA CEO, with the Director of Long-Term Care in the WRHA, with others at that table to discuss what's happening, what steps have been taken. And I want to be clear that my most recent briefing in respect of Maples was on Thursday morning at 8:15. And there was nothing provided to me at that briefing that would have led me to believe that somehow that situation was in imminent danger of deteriorating. So that raises important questions about what was going on at an operational level. I can tell you that when it comes to our assessment of the situation, the operator has said that the nurse complement was appropriate and even exceeding what was required, that there were healthcare aides and other workers on staff, and that the residents were being checked on an hourly basis. I can tell you that my notes from Thursday in that briefing that I received talked about PPE being evident and housekeeping taking place, that the fact that hospital transfers were following established protocols. I can tell you that they referred to the inpatient physician assessments that were ongoing, and they said the Red Cross is arriving and will be on site within less than a week. And there was nothing provided to me at the time to indicate that it was otherwise. So now that raises questions, and we will get to the bottom of those questions.
And as a follow-up, sir, you addressed it earlier. Long-term care homes were one of the first hardest hit in other provinces, whether it be Quebec, whether it be Ontario, and it could have been probably a matter of time before it got here. Now, what I'm interested in is the agreement between private for-profit personal care homes like Rivera and the province. When are you actually able to undertake facility reviews, and what is the agreement between the private facility and the WRHA, and when you can go in?
So to be clear, the provision of care by a long-term care provider is through the regional health authority and not to the minister, so that accountability is held at the regional health authority level. And then, as you say, it is the service delivery arrangement that we do reserve the right to go in and inspect and to do unannounced follow-up reviews. And these things are in place, both in respect of the Revera homes and others across our system. In fact, as you know, there was a scheduled review of Maples only very recently, and then a follow-up review that was only undertaken on Monday. So that assessment and oversight of personal care homes exists in Manitoba. We have a strong system for the review to make sure that these homes are up to standard, and when they aren't, that plans are undertaken to ensure that they get there.
From CHVN, Taylor.
Hi, good afternoon. Minister Friesen, can you talk to us more about the gravity of the situation, why you decided to hold a press conference on a Sunday, which is pretty unusual?
I believe Manitobans needed a very quick response. That's why I directed that those system leaders and Revera would be here in room 68 yesterday at 5:30. I also knew that essentially all accountabilities are up to the minister's office. I thought it would be appropriate for Manitobans to know that the minister and the Health Incident Command Structure are on the job. And I thought it would be important today to reassure Manitobans that even in the short time that has proceeded since that situation, already plans have been made for immediate and interim response.
And Lynette and Minister Friesen, seeing everything going on at Parkview and at Maples, would you feel comfortable having family at these facilities?
I'll speak to that first, and I'll invite Mrs. Zaragoza to do so as well if she'd like to. So as we said, we know from the global experience, and we know here in Canada, that long-term care homes are challenging places to protect during a global pandemic. We just know that in every jurisdiction. It's why we've taken the exceptional set of actions we have in this province, actions that we really believe have kept people safe. But, you know, errors occur and things happen, and it's hard to wear PPE exactly correctly, and visitation produces risk, but not visiting creates risks as well of a different kind. And so that is why we are acting as we are. I don't think there's any indication I've ever received by any of our leading officials, any of our regions, that somehow they don't have a full focus on safety at personal care homes. I think the tragedy in Canada is that despite the best efforts, still COVID has gotten into personal care homes. And that's why today, with this set of actions, we are indicating that if there is something to be learned from this event that took place at Maples, we're going to learn that lesson and fast and put into practice additional measures to keep Manitobans safe.
From the Winnipeg Free Press, Ryan.
So we've got at least 23 deaths at Maples. We got 8 in a period of 48 hours. By my count, at least 121 residents and 55 staff that have tested positive for COVID-19. We got the situation deteriorating to such a significant degree that paramedics are on scene for 7 hours. This paramedic whistleblower describes it as a nightmare. And we got families reporting a lack of staff and inadequate care of residents. And the WPS has confirmed that they're taking a look at this situation. The province is not stepping in and taking over operations at this personal care home. Why not? If not now, when? What would it take? And Minister Friesen, are you comfortable telling Manitobans that you continue to have confidence in Revera to operate this facility competently and safely for residents?
First of all, I'd say none of us are comfortable with this situation. None of us are comfortable with what we became aware of only so recently. On the second question of what would constitute the basis to take over a home, that's why we will do an investigation. We're going to understand what are the claims that the operator is making in respect of the staffing at the time of these incidents. what was happening medically. Nurses have exceptional experience and capacity to treat patients who are chronic care and their residents who are chronic care, nurses in long-term care homes, that is. And when the situation turns to an acute situation, if that happened very quickly, what was their capability and how did they respond? The investigation will determine next steps, even in respect of the things that you're raising. I would want to make clear to Manitobans, as we've said before, there's nothing that we've taken off the table.
I know, but now it's coming on me. Okay.
What is the timeline on this investigation? And also, we have a photo of what appeared to be a body being taken out on a stretcher from Maples last night. Have there been additional deaths at that facility that have not been reported to the public yet?
Better just get a family
Sorry, I'm getting some background noise. Okay, thank you for the question. So on the second question, I'm unaware of new deaths at the home subsequent to what we've just now reported. I could get an update to clarify that. Perhaps one will be provided at this table. And then will you just repeat the other part of the question?
What's the timeline on this provincial investigation? When can we expect it to be launched, and when can we expect it to wrap up?
Yeah. So rapid, because we need answers now. And that is why I'm undertaking this measure, an investigation, an examination of what took place in this circumstance, and then a reporting back of what took place, an exploration of the evidence and information that's been provided. We want to test that. And then we want to know if there are system learnings because of what we've said what we've been told were extraordinary conditions that evolved very rapidly at the personal care home. So soon, and the details of this will be provided to Manitobans soon, and the reporting back of this investigation to my office and then made public also soon.
From Global, Eric.
So in the past 6 months or 8 months since the pandemic began, we've known that personal care homes are a vector for this disease. Why were there not measures put in place prior to the second wave here in Manitoba that would have prevented these deaths?
So in the spring, we saw what was happening in personal care homes in Ontario and Quebec, and the Public Health Agency of Canada wrote up recommendations as to how to keep those long-term care facilities safe and what kind of things we could do in order to prevent the spread or the outbreak situation. So as you know, like we had the visitor restrictions were quite severe in the spring when we started. We loosened that up because we saw that there's risks and there's benefits with not allowing caregivers to be close to their loved ones, and we still believe that. We have went through every recommendation from the Public Health Agency of Canada. We met with leaders throughout the region in long-term care to make sure that every recommendation was being addressed. We have incorporated them into our guidelines that have been distributed. And I would say also the private personal care homes would have received those guidelines too as part of the implementation process. So we have done everything that we can to prevent this from happening. We know it's a risk. We're in a pandemic. We know it's a risk. So if we can prevent it, that's great. If it happens, we have to work really hard to contain it. And the other thing that I've been talking about this week that's really important is that we want to have a provincial system response, but we also have to rely on those local providers to manage the resources from within and escalate to a regional level or a provincial level if more help is required. And not knowing all the details of this situation, it sounds like they were staffed appropriately. for normal operations, but this was not normal. This was more acute, and more reinforcements needed to be there. So I think we've done everything we can think of to prevent COVID from getting into these communities. I think we need to refine our processes and just keep working at getting better and making sure that all the parts of the system are working together to address the situation.
Minister Friesen, 22 people are dead within the past 2 days. Do you take responsibility for this? I mean, I know, of course, it's the virus, it's spreading the home, but you are the health minister. What could you have done better to prevent this?
I would say it a little differently. The accountability is mine. I am the minister. The accountability is mine. I hold that accountability to my premier, to my cabinet, and indeed to all Manitobans. And so the buck stops at my office. And so that is why every day we're on the job, working as hard as we can, going flat out, talking to people in our jurisdiction, relying on our leadership, giving good information to Manitobans, putting in place the things that need to be put in place to keep Manitobans safe. That's not easy for anyone, and I am honored to be part of the team that I am part of. So what we can do is more, and we have committed to do that today. We saw some extraordinary circumstances in the last 36 hours. That evolved very quickly. We have responded, but we will respond more. That's why the investigation. That's why that rapid response team. That's why the Red Cross is arriving and starting in 5 days. That's why we've directed for the additional active outreach to all personal care homes. That is why we are calling on this new task force to sit at the Health Incident Command structure and give specific leadership, even in a more elevated way than before. I hope that helps to answer the question. Manitobans have a right to believe that this team is doing all they can to keep people safe, and that's the assurance that I can give.
From the Brandon Sun, Tyler.
Hello, sir, folks. Thank you for taking the inquiry. Now, thinking about Daughter on Call, private care home in Brandon and Westman that saw multiple health infractions reported early in the pandemic, including locking out inspectors at one location. They've been fined, but now, given what's happening in Winnipeg, I'm concerned about the follow-up. First off, what kind of follow-up might have taken place? Maybe not this place specifically, but what kind of follow-up did take place, and will follow-up change with the plans announced today?
So I would just want to be clear that the organization that you named does not provide care in Manitoba's long-term care homes. My understanding is that that agency provides care in assisted living complexes and other places. So I think you are correct that there were some actions undertaken earlier, and I don't know what the follow-up was specifically in respect of that agency you named, but we could follow that up for you.
And you'd mentioned additional supervision at the operator. Now, is that Maple specific or all Riviera? Because I'm thinking that Brandon has a Riviera. I'm sure that other locations in Manitoba have a Riviera care home.
Yeah. Not either or, but both and. So I have recommended, I've directed the WRHA to provide additional supervision of those sites, but I will also receive advice as to what level of additional supervision based on evidence would be necessary at other sites operated by this particular operator.
From the Winnipeg Sun, Glenn.
Yes, Mr. Minister, Glenn Dawkins from the Winnipeg Sun. While I respect that and they're gathering information. We've heard from families who would like action now. Why is not the province considering some kind of a takeover of Naples while this review takes place? Or has that been considered by the government?
So action now is exactly what Manitobans are getting in respect of the direction that I've given to actively outreach to all personal care home providers to say there are things you need to watch out for as care can move from more chronic to acute, and we need to watch medically for that. There is response immediately in terms of this rapid response unit that actually yesterday, even within 24 hours, was already operational and providing care and activated. So thank you to all of those who have helped already to provide that response. And then care and action right now is also being promised in terms of an investigation that will take place that will report back post haste and provide information and direction about next steps.
Joe Biden and Trump is around 47.8%. So you understand how close it is. It's a messy election. It's a close election. But today we are going to talk about implication of this election and Joe Biden winning, hopefully, or we don't know the future, on the climate implication. I have a great panel to discuss that. Let me introduce the panel to you. I have Dr. Salimul Haque, climate expert. He's from ICAD, International Center for Climate Change and Development from Bangladesh. And Dr. Haque is one of the most revered climate experts internationally right now. Thank you, Dr. Haque, for joining the program and making time for it. I have Ms. Chandra Bhushan, CB, as we call him, CB. CB is a very eminent environment and climate expert from India. He has formed an organization called International Forum for Environment, Sustainability and Technology. I believe I got it right. It's called iForest, that's the shorter form. And he has been part of CSE, the Center for Science and Environment, for more than a decade. And I have with me Aarti Khosla. Aarti is a communication expert. You have a COP and Aarti is there doing
a sea change in the global economy. Imagine, in 2006, several of the wealthiest foundations hired a Imagine a sea change in the global economy. Imagine, in 2006,
there are all these different steps of development in fetal life that are set up by nature in a very determined way, and they have to go just right.
Being born too small or too early have a dramatic impact on the development of that child, and even when that child grows, impact on their future health.
We tend to be so focused on what we have to deal with at the moment. I think it's important to look back up the chain and see what the modern
While much of the world stays home, Canada's fertilizer industry keeps working to ensure the food we depend on grows better and stronger. Because without fertilizer, harvests would be cut in half. The nutrients in soil must be replenished for the next harvest. To recover from this crisis, the world depends on us. We secure tomorrow's food by fertilizing crops today. To keep things growing, you can count on us. To learn more, visit us at fertilizercanada.ca/COVID-19.
I was feeling really isolated and lonely. So I had some friends over. It was just for a couple of hours. It wasn't a big deal. I hadn't seen my parents in weeks. They were so happy to see me. Online classes were so stressful, so I took a me-day. And all the rules and changing restrictions can be so exhausting. But then I got COVID. Luckily, I was healthy. Took a while, but I recovered. It doesn't work that way for everybody.
Good afternoon, and thank you for joining us for our weekly update. I'm very pleased, as always, to be joined by Dr. Lawrence Loh, our Chief Medical Officer of Health, as well as Tim Beckett, for the final time, our Chief and our Director of Emergency Management, our Fire Chief, rather. I'm guessing some of you are a little tired today. I know I am. I was up pretty late last night watching the U.S. election results come in. What a nail biter. I really hope we get some clarity today, a definitive answer on a winner. Hope it sometime very soon. I'm not sure any of us can take any more of this drama. But before I provide my update, I do want to take a moment and express my deepest sympathies to